Hello. So welcome back to my channel. I'm still Gotchun, and I did mention that I will talk about asthma. So previous video I did talk about type 1 diabetes and type 2 diabetes, and you haven't listened or watched the video, you can learn from the video where there's link in the description below. And so let's begin to talk about the new topic today. It's about asthma. So the medical conditions. I want to explain the definition, the root cause, the clinical manifestation, the risk factor, the pathogenesis, diagnosis, interventions, and how to prevent asthma in this presentation. So the definition of asthma from the Harvard Medical School explained that asthma is a chronic respiratory illness. So it's not the word chronic here, it's long term. And the cause is a chronic respiratory illness, narrowing esophagus, like the throat, and developing inflammation inside the lung, causing bronchitis, so inflammation to the bronchi. Also vaginitis, if I pronounce it right or not. So also like causing inflammation inside the lung, the throat, and difficulties in breathing and wheezing, and flare-up symptoms like allergies. And there's no cure for asthma, but it can be managed with medication and lifestyle changes. So the root cause of asthma develop from allergens and virus infections. So allergens can be found in animal dander, saliva, pollens, molds, dust mites, cockroaches, some medications that contains allergies, and some certain foods and drinks that contain sulfites. So in this case, sulfites, food, including wine or beer. So these are all allergens that can develop asthma. And then viral infections include like cold flu virus, like influenza type 1, type A, type B, and type C, etc. So these are the etiology of asthma development. The symptoms including skin rash, runny nose, extreme shortness of breath, wheezing, fatigue, persistent coughing, chest tightness, rapid pulse, so like fast heart rate, sweating, flare nostril, like respiratory distress, difficulties in breathing, pursed lip when the lip presses together in a round shape, and a need to sit upright, and a blush decolorization of the lip and fingernails, usually like pale looking or dark cyanose or purple appearance on the lip and the fingernail. So, and it's comorbid with respiratory infection from cold or influenza virus. So the symptoms will look similar to allergy reaction. And another word in this condition we call anaphylaxis. I will discuss about this in the pathophysiology, but we need to learn what are the risk factors influencing asthma. It might be a surprise that risk factors, including smoking or vaping products, that affects the lung functions, allergens, including animal dander, saliva, pollen, molds, dust mites, cockroaches, some medication side effect, and certain foods or drink that consist of sulfite ingredients. As I mentioned, including in the wine or beer, and viral infections from cold, flu, physical inactivity, breathing cold air and dry air, especially during winter, environmental pollutants like cigarette smoke, wood smoke, pan fumes, and chemical release from the factories, and pollutions in the environments that spread into when you breathe in those smokes, increasing the risk of asthma, strong unwanted smells or contamination, emotional stress, like for those being too excited or too upset, it can also trigger asthma development because it's linked to stress hormone, family history of having severe allergies, inherited genes like those born with high immunoglobulin E, the IgE, that can develop asthma not more than normal people, cold flu symptoms but untreated, so then it can develop to asthma when it becomes autoimmune. And then one more thing about the risk factor influencing asthma linked to thunderstorm. So thunderstorm asthma is triggered by a combination of high ryegrass pollen levels and a certain types of thunderstorm, causing pollen grains from ryegrasses to be swiped up in the wind and carry long distances. So pollen can burst open and release tiny particles that are concentrated in the wind just before the thunderstorm. And these small particles get deep into the airway and can trigger serious asthma symptoms. So before the thunderstorm appear, the wind when we breathe in those windy environment, the atmosphere, the pollen in the atmosphere and the particle, it goes in deep into the areola. So this part will affects the lung, and then it develops serious symptoms of asthma. And if untreated, then asthma development occur. And what is the pathophysiology of asthma? The pathophysiology of asthma developed when the immune system got infected by pathogens inside the lung, where inhalations and mouth and nose, due to allergens and viruses, it triggers anti-inflammatory response to release chemical, and the anti-inflammatory response become hyper-responsive, while antigen-presenting cell got attacked by the immunoglobulin E antibodies. So the B lymphocyte, it produced the IgE antibodies as a response to allergy reactions. However, it's produced those, again, invasive pathogens. In turn, it attacks the antigen-presenting cells as well. So it's not an autoimmune, but these attack, and the virus, basically the pathogen wins the healthy cells. To just say in a simple word, it manifests into allergy symptoms, and this condition known as anaphylaxis. When the infection spreads to the lung, it will cause inflammation to the bronchi, causing bronchospasm or bronchitis. Esophagitis, like affect the throat, like having sore throat symptom like flare up nostril, difficulties breathing, shortness of breath, wheezing, coughing, low oxygen level, or develop ischemia. Skin rash and irritation, and until the degree of having life-threatening episodes called asthma, if uncontrolled. So what are the diagnoses for asthma? So we can check if a person has asthma by physical examination. So do the palpation, inspection, and listening to the lung sounds. Chest, usually they have chest pain. So the doctor may perform spirometry test to check the lung function, skin assessment, blood test, and check the allergies medical history. If those who have severe allergies with dust, pollen, moles, grass, they are more likely to develop into asthma too. So what are the intervention for asthma? Before I'm telling the specific, these generic name, please let me know in the comment below. But these are bronchodilator that used for asthma, inhaler puff, they were the administration, corticosteroid to administer with oral inhaler, allergic rhinitis with like hay fever medication, biologic agents, and injectable medication like adrenaline. So these are to manage allergy reactions, and patients should avoid aspirin, non-steroidal anti-inflammatory drug, beta blockers, like for those with hypertension, on hypertension medication, echinacea, royal jelly, and andrographis paniculata. It's the name of the medication that need to avoid if those are having asthma conditions. And it's I highly recommend it to consult with immunologist, allergy specialist, GP, or doctor. So how to prevent asthma? Simply wearing mask if having cold flu symptoms. Avoid breathing in cold air during the diagnosis of cold flu or asthma. So it's hard to avoid cold air in the winter, but it's good that we avoiding ice cold consumption during winter, or like get exposed to air conditioner that it increases the flu symptoms, then it develop into asthma easily. Hand hygiene, overall health care, so brush your teeth more often. Again, caring for yourself and significant other with your own precaution. Avoid food or drink that contains sulfites. So it's such as wine, beer, food that uses additional color preservation. So these are the food that contains sulfites. Physical exercise, wet breathing exercise, carry asthma medication whenever you're traveling. If possible, avoid what makes you feel discomfort when breathing, like the place that include allergens, moles, dirty carpets, and people who already got sick. So like stay away from people if you got sick. Avoid food allergies consumptions. So we know that people may have allergies to specific food that are increasing their allergy reactions, that it contributes to asthma. Avoid smoking or vaping. Environmental pollutions like cigarette smoke, wood smoke, pan fumes, chemicals. For more information, visit Allergies and Anaphylaxis Australia, or Australian Clinical Immunology and Allergy Specialist Australia, and other government websites that are useful for longevity, preventing short life expectancy, since there's no asthma vaccines, and it tends to develop for those aged 9 years and above. So these are all about asthma conditions. If you have any questions, please let me know, and thank you for watching. See you in the next one.